Right, everybody. Okay, let's see effects. Wow. Okay. Hello. All right. Uh, Thank you so much for tuning in for the weekly live sessions. Actually, we're live at two different platforms, um, TikTok as well as the YouTube channels. Okay, so live sessions. Just want to give it a try. Okay. So something we're doing a little bit different since last live session is instead of we answering questions. So today we're gonna talk about specific symptoms. One of the common conditions we treat here in the clinic. So every week we'll pick a topic that is commonly seen in your practice, and we just want to share with everybody what causes it, what are signs to look out for, and what can you do to prevent it. So if you have a question for us, don't be shy. Feel free to leave in the comment section, and I'll address that kind of towards the end of the live sessions after I go through all these informations first. So if you have questions, feel free just to type it in, and I'll address that kind of towards the middle, later part of live session. So let's dig in. We only have about half hours of time, so let's all learn something today. Great. Okay. Okay. So today, as from the title, we talk about a tailbone pain. There is a more medical term for that is a coccyx pain. So I will talk a little more in depth, like what causing it, what it is. So first of all, let's look at where it is in your body. Okay, a lot of times, I see this all the time in practice that patient, I have tailbone pain, and they point is actually their back. So your tailbone is actually much lower than your back. Okay, so let me show you where it is. All right, so in my hand, this is a spine. We're looking, so looking from the behind of the spine. So this is the back of the spine. This is the front of the spine, and this is the side. So we are looking from the back. Okay. So a lot of times when a patient was saying like, oh, I have tailbone pain, then they point here. This is not the tailbone at all. This is your back. This is your lumbar, like your lower part of the spine. So the tailbones, what the proper term to call it is called the coccyx. So it actually is this tiny, teeny triangle anchor looking bone right here. Okay, so these are kind of like the wisdom teeth that is being over the evolutions. You kind of like, we are came from primates. We used to have tail, but the tails kind of slowly evolved away, erased away. So we still have some kind of structure in that. So this is what it is. It's basically the last piece of the spine, part of the spine. Okay, so it's right here. It is putting together by a very movable joints. So they are not 100% fused. So it's a lot of flexibility in here. And you cannot see it here because this is just a bone structure model. So, but when you're looking at it from with all the muscle layers and all the tissue around it, it actually has a lot of nerve endings, and as well as it have a lot of ligaments around it. So it is this piece of bones. It is quite movable, and it can be very sensitive because you have a lot of like tissue and nerve ending towards it. So it's very easy to get injured. So let's see what kind of things or can cause pain in this area? Well, if you go skating, or if you were maybe you are walking on a very slippery road, you kind of slip and fall, and then you kind of land on your bum, and then this is usually where you're gonna land on. Sometimes, depends on how you landed, sometimes you might land on your issue too, which is right here. This is kind of like the bony part of your bum. So sometimes you might land here. But if you land leaning back a little bit, so then you'll be slammed right into the coccyx bones. So if you are joining me right now, today we're talking about the tailbone issues we come see in our practice. If you have questions, feel free to leave in the comment sections, and I will answer them kind of towards the middle and the end of the live. So we figure every week we want to discuss about the conditions, maybe one or two conditions we are commonly seeing in our practice, and I can share with you what causing it and what can you do to make it better. Okay, so today we're talking about the tailbone issues, where it is what is called in here is the coccyx, which is the last piece of continuation, last piece towards the sacrum. So this is a triangle spine right here. This is the sacrum, and this is the ilium, which is attached to it. They are put together by a lot of ligaments in between. Okay, so it's right here and here. Okay, all right. So what caused pain here? So like what I mentioned, this is a very sensitive area. It has a lot of ligaments. We have a lot of like nerve ending in the area. So if someone maybe slip and fall, or if they go, they land on the bum. So usually, sometimes you land on your issue too. Sometimes you land right onto the coccyx because this is very mobile. So these pieces of the bone can be easily, well, let's look at it from the side, easily tucked in, meaning like going this way. Okay, so when it does that, it's very, very painful. Not only that, some simple things will be very difficult for you, such as sitting on a chair, sitting on semi-hard surface, as well as maybe going to the bathroom, or having difficulty pushing your bowels or that. So these are the symptoms of the coccyx. So if you have a question, feel free leave in the comment sections, and I will answer that kind of towards a little later part of the live. So just kind of stay in the live, and we can talk about this condition first, and I will answer all your questions towards the end. Great. Where am I? Okay. So that's one of the cause of this tailbone pain, which is like trauma, accident, such as slip and fall, or slip and roll, you slip and you land on your bum. So this is one of the cause. So the other cause is it's usually happening in women who kind of injured this area during the childbirth, either during pregnancy or during the childbirth process. So this is a part can be even injured. So how does that happen? Like how does the childbirth can cause like coccygeal pain, the tailbone pain? Well, is when a woman is pregnant, usually there's a lot of changes happening in the pelvic region. So the pelvic kind of expand. So obviously the baby is growing inside of you. So once your pelvic expand, things will be really stretched out. And sometimes really depends on how the baby coming out from the birth canal can like push this one, can push this one out of the place. So that's how people have issues or tailbone pain during the childbirth. So the common symptoms, if you have a tailbone pain, is the common symptom is maybe you will be experiencing some difficulties going to the bathroom, such as push your bowels. difficulty sitting on the hard surface, that does happen as well. Then yeah, so usually those are the common things people experience. Do keep in mind, it doesn't only happen to men, women, it happens to men as well. If you have like injuries or something happens, then obviously like you will injure this area. So what can you do to make it better? Okay, so a few things. If this coccyx issue is not so serious, it can just go away on its own. In fact, there's a lot of minor issues in your body. If you just give it a proper rest, it will go away on its own. Just give it a proper rest, don't aggravate even further, don't overuse it, just let it rest, then it will go away. But if it doesn't go away, then there's something you should do about that. Okay, first of all, you need to making sure you are not keep aggravating the problem. You see, like obviously this part of the joints, big tucking, is very sensitive. You probably shouldn't put more pressure on it. So what I mean by that is you will need to, whenever you sit down, you need to have some kind of a cushioning, or usually in our patient here, we recommend they be sitting on some kind of like a donut. So you mean like a so your bum is kind of sink into the hollow part of the donut, and that, you know, so your bottom of the buttock area is not touching anything. So in the way that this is not, you know, putting pressure on anything. So this is one of the ways for you to kind of not aggravating it. Okay. So from chiropractic perspective, like how do we treat this? Usually when patients have this kind of problem is they try everything. So they try not aggravating it, they try not to sit on it, they tried, you know, like just trying their best to make it better, but it's not getting better. So that's where we come in. Okay, so how do we make it better? Yes, because these tiny little joints, they're so sensitive, they're so fragile, so you can easily tuck it. So we're gonna try to do something to bring this part, so going like this way. So try to bring it back. So by doing that is we do have this specific technique we're using the ligaments of the sacrum and the coccygeal joints. We use that ligament as a fulcrum, so we put them up. So this is one of the ways we do to make it better. Okay, all right. So this is what we talk about in the coccyx bones. Okay, so since we are in the lower part of the spine, let's talk about one of the very, very common symptoms we see is the sciatica nerve. Okay, so sciatica nerve coming from the lower part of the spine, exiting from the lumbar spine, the lower back part of the spine, exiting from that, and it will pass through this ilium. So it's actually, if you from anatomy point of view, it can be quite thick nerve, spinal nerve passing through your hip region. Usually you're passing through here, so you're going to diagonally. Okay, so the sciatica pain is mainly caused by the muscle and layers around this area is constantly compressing on that nerve. So they constantly squeezing on that nerve and compressing on that nerve, so cause like inflammation of the nerve, so the patient will experiencing pain and whatnot. Obviously, for minor sciatic pains, you can do like stretching to make it better, because basically it just really the muscle pressing on the nerve. That's really what caused it. Let's see if it didn't get better from that. Then you might need to look into like what other things could be causing it. Is it because you have some hip issues, underlying hip issues, or underlying vertebral issues, maybe in the lower back, and that is kind of like causing the condition not getting better. Okay, all right, okay, so if you're just tuning in, we are just talking a little bit about these common conditions we see in our practice. It's called coccygeal pain. It's like this little tiny little part of the joint. Sometimes this one get dislodged and displaced and it causing pain in that. So in that, and also will be like touch a little bit about the sciatic nerve and what is sciatic nerve and what causing it. Is actually just sciatic nerve is usually a slightly bigger spinal nerve that is kind of passing through the hip part of passing through the ilium. It's part of the hip structures, and the muscle on top of it is kind of like pressing and squeezing on that sciatic nerve, and that's where you're having the sciatic pain. Most of the people are having, if it's not so serious, you can by reduce the conditions by resting, stretching, and just try not to aggravate the condition to make it worse. You can do that if this condition is not so serious. But if this condition is quite serious, you might need to do some further imaging, such as X-rays, MRIs, just to figure out what could causing it. Okay, so thank you so much for listening into. I talked about these two common conditions we can see in the practice, in our chiropractic practice. So now I'm going to address some of your questions in the comment section. So if you have any questions, please just type in, and I will try to address them as much as I can. And yeah, just put it in the comment sections, and I will try to address that as much as I can. I feel like I just said that twice. I think I did. Okay, so I hope this person is still tuning in with us. Its name is Oat Milk Latte. It's very nice. It's a cool name. I love latte. Oat milk latte is not that bad either. It's really good. If you're lactose intolerant, you can still enjoy latte without getting all the diarrhea. Okay, so oatmeal latte asks, hi, may I know where you're located? Okay, so for you guys that are watching, we're actually located in Singapore. We have two locations here in Singapore, one in Lavender, one in Harbourfront. If you want to find out more about what we do, you can go follow us on TikTok or follow us on YouTube, and you can just click the link in your bio. You'll find out more detail about where we are and what we do, and find out more about our doctors too. So in our practice, we have 3 chiropractors. So I am one of them, and we have 2 other male chiropractors. We have 2 centers in Singapore. So yeah, depends on where you are. One is more in the central area, the other one is a little bit towards like east part of Singapore. But yeah, so we've been around. I've been a chiropractor more than 10 years. My other 2 chiropractors, one of them has been a chiropractor more than 10 years. Then yeah, so together we offer we actually use a lot of modalities to help our patient to get better besides chiropractic. We also have like spinal decompression therapy, which is great for slip disc, and as well as dry needling. Although the dry needling process can be a little bit painful for some people, so if you are like really afraid of needles, maybe it can be a little bit painful, but it's very good for like muscle tension recovery, sports injury recovery, or just like constantly tightness, tension in the muscle and ligament. So the dry needling really helps. So we in our practice, we also see like pediatric chiropractic. So for myself, I'm trained in that as well. So we see a lot of expecting mom, people who just giving birth, as well as like babies, infants, toddlers, and preteen and teenagers. So yeah, so we cover quite a wide range of conditions and symptoms that can help. So if you want to know more about that, you just go ahead and click link. Right? If you're watching YouTube, just go to our channels and click on about. If you're watching from TikTok, just follow us on TikTok and also click the link in our bio. That will have all the information for you. So great. Okay, let's move on to the next questions. So again, if you have questions, please put it in the comment section. Same thing for people who are watching from YouTube. If you have questions, just key in the comment sections and I will answer them as the best I can. Okay, so let's go to the next questions. Okay, great. The next question is from Hazelme. I hope you say your name right. Hi, I'm from the Philippines. My shoulder blade area hurts. What do you think the problem? So that's very limited information given to me, so I will try my best to answer that. So the shoulder blade pain could be a lot of things. It could be tension in the area, maybe in your upper back. One more thing I want to know is, do you have any injury in the past? Were there any history of overuse? Were there any repetitive movement you've been doing can cause that? Also, is there how long you have this problems? Is it something chronic or you have been around, having it for quite some time or not? So really depends on what it is. Again, like what I said in the beginning, if the problem is not serious, try the stretchings, try the rest. If it's not so serious, usually you will go away. Yeah, if it's not serious, just give it a few days, you will go away. But if it's not going away, then usually it's something a little more serious. So then you needed to look into what could be causing it. So things to look out for is it getting worse or is it staying the same? Does it comes and goes? So for any time you potentially have a problems, either it's a joint, a muscle, or mobility issues, so you need to ask you these questions like, is it getting better? Is it getting worse? Is it staying the same? Does it come and go? Is it episodic, meaning like, oh, for a while I don't have it, and after a while I have it? So those things to look out. And also what kind of pain you have in the area. Is it just like a dull ache kind of pain, or is it sharp, or is it numb? Does it have tingling sensation in it? Do you feel a burning sensation in it? So all these are potential clues to identify what could be the potential problem. Sometimes people tend to, like, oh, maybe it's not serious, so I would just try to live with it. Like what I said, if the problem is not serious, then you should go away. But if it's not going away, then you try to, you kind of come to peace with it. It's really not the best approach. So meaning like whatever problem you have in there, it did not get better. So it's very important to make sure you try to either check it out, see what really happened in there. Maybe if it's been there for a very long time, sometimes the healthcare provider, doctors might want to require some special imaging, such as like X-rays, MRI, all these kind of things. Yeah, so that's a little bit of we would like to have more information about it. The physician, does it have a clicking sounds? Do you have pain in the area? So all these are things needed to look out for. So if you have questions, please comment below. Just comment that. So today we talk about the tailbone pain, like the coccyx pains, what causing it. Usually let's see, where is it? Is it in this area right here? Is this kind of like an acre-like bone structure? It's very sensitive. They have a lot of ligaments and nerve ending in the area. So what it does is, actually it doesn't really do much. It's kind of like your appendix. It's just there. By just your wisdom teeth is there, but doesn't do the same thing with this. It's just there. It doesn't really do much, but it can be injured from like slip and fall, childbirth, all these. It can be injured in the area. So once you get injured in the area, it can be quite sensitive and quite painful from time to time. So yeah, so definitely if you are experiencing some kind of a problem like that, it's best to, again, if it's resting, it's getting better. If it's not getting better, then you should have, consult and see someone about that. Okay, and any more questions? All right, please put in the question. Okay, let me see if I missed anything. If you guys have any questions, just go ahead and key in there. So people who are tuning in from YouTube, if you have any questions, you can also tune in over there. That'd be great. Okay. All right. So if you're looking for more information about what can you do to treat like minor issues, in our TikTok, we do have quite a lot of videos such as stretchings and tips you can use as a part of your like everyday. If you're just working from home, studying from home, you're not doing a whole lot of activities, you can just try the stretching and the exercise tips we have in our TikTok. So yeah, so you can go ahead. Try to look for that information and try for yourself. Like what I said, if it's a minor issues with some rest and some stretchings, you can go away by its own. But if it's not going away on its own, then it's kind of like something a bit more serious. So that's when you start to perhaps to look out for and look out for and find a solution for it. Okay, so we're getting kind of a little bit closer to the end of the live. So I just want to give everyone a little bit of an update for next week. So for next week, we're doing live at the usual time of 4:30. I will have a guest here with me. So please tune in. So during that, we'll talk about like some of the common sports injuries and what you can do to prevent those sports injuries. So if you are an active person, I highly recommend you tune in for the next week at 4:30, Tuesday, 4:30 Singapore time, every Tuesday, 4:30. So you can tune out for that. And also, if you are, let's say, not very active person, but thinking about trying to be active, think about what kind of exercise you should consider. You also can join with that. We'll talk about, as a beginner who wanted to engage in, try to maybe engage in a better, a healthier lifestyle, what can you start with? So for next Tuesday, I will have a guest here with me. So please feel free to come in. Yeah. Okay. All right. So we're getting very close to the end of the live sessions. So I just want to keep it quick. And please follow us on TikTok. If you're watching us from YouTube, please making sure follow us on YouTube. We do post a few times a week and try to share information about stretchings and how to keep your spine healthy, how to keep it moving, how to make your joints better. Okay, so please tune in for that, and do follow us on TikTok for more information on that. So we do a weekly live session every Tuesday. So next Tuesday I will have a guest here with me. So maybe we will do a little bit of a longer live sessions. So if you have more questions about like how to get into fitness, what are the common sports injuries you might encounter, all that stuff. So I can talk about, we will be talking about that during next week's live session. Okay, all right. Alrighty then, if you got no more questions here, so thank you so much for tuning in. That was very good of you guys. Okay, so please follow us. If you're watching us from YouTube, please follow us on YouTube. If you're following us on TikTok, please watching us from TikTok, please follow us on TikTok. Okay, all right then, I'll see you guys next week with our special guest. So we have a live